Ang maayos na nutrisyon ay ang pundasyon ng maunlad na bayan. Well-nourished mothers give birth to healthy babies who can achieve their full growth and development potential to become productive adults and live better lives. Kaya naman, ang pamahalaan sa pangunguna ng National Nutrition Council ay higit na paiigtingin ang pagtugon sa hamon ng malnutrisyon sa ating bayan. Ang tugon, ang Philippine Plan of Action for Nutrition 2017 to 2022 o PPAN.
The Philippine Plan of Action for Nutrition, or PPAN 2017-2022, is an integral part of the Philippine Development Plan 2017 to 2022. It is consistent with the Duterte administration's 10-point economic agenda and the Philippine Health Agenda. The PPAN consists of 12 programs. 8 are nutrition-specific, 1 is nutrition-sensitive, and 3 are enabling support programs. We have had previous PPANs before, but much more needs to be done to improve the implementation of nutrition plans and programs. We are better placed now to achieve our goals because we are guided by data and benefit from local and global evidences on what works and what needs to be done. This has allowed us to lay out clear-cut plans and programs with goals to which we can measure our progress. Ultimately, ito ang mga gusto nating makamit. We want the prevalence of stunting and wasting to significantly improve. Gusto din nating bumaba ang bilang ng mga sanggol at bata na biktima ng micronutrient deficiency o yung kakulangan sa vitamina A, iron at iodine. Gusto nating mapababa o kung hindi man ay hindi natataas yung prevalence ng overweight at obesity sa mga bata, sa mga adolescents or teenagers at sa mga adults. If we achieve these goals, we contribute to the improvement of the quality of our human resource base. We also reduce inequality and we also reduce maternal and child mortality. These are the measures that we need to live up to for us to be able to say that PPAN 2017-2022 is a success.
The road towards a well-nourished nation starts in the mother's womb.
Poor nutrition during pregnancy compromises the growth and development of the child in the mother's womb. When a mother isn't getting the proper nutrition for herself and for her baby, the child comes into this world malnourished. So sa simula pa lang, dehado na yung bata.
Deficiencies in key nutrients inhibit the normal growth and development of the fetus. In some cases, it may even threaten the child's survival.
When growth faltering happens in the first 1,000 days of life, undernutrition, particularly stunting, happens.
Stunting is irreversible. Children who are stunted have diminished cognitive and physical development, reduced productive capacity, and poor health. Buong buhay na papasanin ng isang tao ang mga epekto ng kakulangan sa nutrisyon simula noong siya ay pinagbuntis ng kanyang ina. Focusing on the first 1,000 days of life is one of the strategic thrusts for nutrition action of PPAN 2017 to 2022.
The nutrition-specific programs are programs that address the immediate causes of malnutrition, yung lack of food at saka disease. The nutrition-specific programs will have more sustained effects if the more underlying causes of lack of income, lack of access to goods and services are addressed through the nutrition-sensitive programs. Intensified LGU mobilization is actually working closely with the LGU to capacitate them to plan, implement, monitor, and coordinate their local nutrition programs. GDAs are geographically isolated and disadvantaged areas, and IPs are indigenous peoples, and the PPAN wants to make sure that these groups are specifically reached by services. And in doing that, we also have to recognize that the IPs have their culture, and we should respect that in the design and implementation of nutrition programs. Whatever the LGU does, they should be supported by the adequate policy support coming from the national level in planning, implementing, coordinating nutrition programs, and in many cases also provide supply and funding support, especially for poor municipalities.
Nutrition-specific programs are interventions that directly address malnutrition that is caused by inadequate food and poor dietary intake and poor maternal and child care.
Kailangan ng support system na nakapalibot sa nanay at sa kanyang baby. We need to provide them an environment where health and nutrition services are available and accessible.
There are 8 nutrition-specific programs under the PPAN 2017 to 2022. First, the Infant and Young Child Feeding Program encompasses promotion of exclusive breastfeeding for the first 6 months and appropriate complementary feeding with continued breastfeeding up to 2 years and beyond. The program shall cover at least 90% of all children aged 0 to 24 months. The IYCF components aim to ensure that all environments support the mother for optimum infant and young child feeding. Second, the integrated management of acute malnutrition will provide nutrition and medical services to almost 800,000 moderately and severely acute malnourished children 0 to 59 months old. This program includes the provision of ready-to-use therapeutic food and ready-to-use supplementary food. Ikatlo, ang National Dietary Supplementation Program na dating kilala sa tawag na Supplementary Feeding Program ay naglalayong madagdagan ang kalidad ng pagkain ng mga buntis, nagpapasusong ina, 6 hanggang 23 buwang gulang na mga bata mula edad 3 hanggang 5 taong gulang at 6 hanggang 12 taong gulang. Layunin din ng programang ito ang mapaunlad ang sistema ng school-based feeding program sa mga pampublikong paaralan sa elementarya at maging ang pagtatayo ng mga food plant para sa produksyon ng complementary foods at ready-to-use supplementary food.
The National Nutrition Promotion Program for Behavior Change shifts from the usual increasing awareness of nutrition messages towards a strategy that will enable the adoption of positive nutrition behaviors. We have several components, including nutrition promotion in schools that will be done primarily with DepEd, the DOH, LGUs, and then we also have nutrition promotion in communities with the DOH and LGUs as the primary implementors, and then also nutrition promotion in workplaces. So that's with DOH and the Department of Labor and Employment. This component will also support having an enabling environment for these behaviors to happen.
Ikalima, patuloy ang paglaban sa micronutrient deficiency sa pamamagitan ng micronutrient supplementation. Libreng ipamamahagi ang mga supplements na vitamin A capsules, iron folic acid tablets at zinc para sa mga sanggol, mga batang mag-aaral, women of reproductive age, mga buntis, at mga nagpapasusong ina. Sixth, the mandatory food fortification program complements the micronutrient supplementation program. Itutuloy ang pagdadagdag sustansya sa mga pangunahing pagkain ayon sa Food Fortification Law at Salt Iodization Law. Kasama dito ang pagdadagdag sustansya sa harina, bigas, mantika, asukal at asin. Seventh, the Nutrition in Emergencies program assures nutrition protection and food availability during emergencies and disasters. Through capacity building, local governments will be able to integrate and institutionalize nutrition in emergencies and respond appropriately during and after the emergency to prevent the deterioration of nutritional status of vulnerable populations and improve resiliency. Lastly, the The Overweight and Obesity Management and Prevention Program recognizes that overweight and obesity are primary risk factors of non-communicable disease such as cardiovascular diseases, stroke, cancer, and diabetes. The program focuses on promoting a healthy food environment, promotion of healthy lifestyle, and weight management interventions to address this emerging trend. Complementing these nutrition-specific interventions are nutrition-sensitive programs. These are development projects that were tweaked to produce nutritional outcomes.
Na ay mga proyekto ang gobyerno na sa unang tanaw ay walay kalabutan sa nutrisyon. Nutrition-sensitive programs are development projects that are tweaked or modified to produce nutritional outcomes. Tweaking or modification can be done by targeting households with undernourished children or nutritionally vulnerable groups, or targeting areas with high levels of malnutrition, or being a channel for delivering nutrition-specific interventions.
Isang magandang halimbawa nito ay ang construction ng farm-to-market road sa bayan ng Bugey, Cagayan Province. Ang mga trabahador ay mula sa mga pamilyang may malnourished na anak upang mabigyan sila ng kita. Kapag may trabaho ang magulang, mayroong pambili ng pagkain at ibang pangangailangan ng pamilya.
With the enormity of the challenges ahead, this is a creative way of addressing the underlying causes of malnutrition.
Kailangan nating maging maparaan sa paglaban sa malnutrition dahil limitado ang ating resources. Patuloy tayong makipagtulungan sa iba't ibang sektor para labanan ang malnutrition.
Nutrition supportive programs are non-nutrition intervention programs, but these can contribute and produce nutritional outcomes like immunization, deworming, and environmental projects. Enabling support programs will make sure that government agencies and other stakeholders move in unison to achieve the goals set out in the PPAN.
One of the strategies in implementing the PPAN is the mobilization of LGUs. Some places, however, require a more intense response to the specific challenges in their areas. But we should always keep in mind that PPAN is for the entire country. Our local chief executives should take the cudgels here as heads of their nutrition committees and make sure that the program reaches to the barangays and the households. Nutrition action officers and nutrition program coordinators, and especially the barangay nutrition scholars, these are our prime PPAN advocates. These frontline workers will be continuously empowered and mobilized so they can effectively implement our nutrition programs.
In support of the PPAN, the National Nutrition Council will push for legislative measures to make nutrition a priority. It will continue to conduct public advocacies that raise awareness, and it commits to keep an eye on government agencies to make sure that the nutrition agenda is top of mind.
And the Secretariat will make sure that the PPAN will be implemented.
As the Secretary of Health and the Chair of the Governing Board of the National Nutrition Council, I will do everything in my power to ensure that the PPAN will be fully implemented. The Department of Health is committed to bring health and nutrition services to our people. I call on other government agencies to support the PPAN by investing in nutrition and realigning policies and plans that will support nutrition. I invite all local chief executives to support the PPAN by ensuring that nutrition services are made available to all. Mga nanay at tatay, kung gusto ninyong lumaki ng malusog at produktibo ang inyong mga anak, tiyakin ninyo ang kanilang tamang nutrisyon. Sama-sama nating itama ang nutrisyon ng mga Pilipino. Sama-sama nating suportahan ang Philippine Plan of Action for Nutrition.